Well, the CDC is expanding its risk factors for coronavirus complications, and it impacts about 2/3 of Americans.
CDC now says people who are overweight, not just those who are obese, are at an increased risk. Our Dr. Nandy joins us live. Doc, many of us maybe carrying a few extra pounds and is ideal. So how concerning should this be for us?
It's super concerning, Dave, especially with COVID-19. A recent review, in fact, of 75 studies found a strong link between people who are overweight or obese and higher risk of hospitalization and even needing intensive care unit. We just saw that with our president, right, last weekend, yet he was admitted he was in the obese category. Right now, around 32% of adults in the U.S. are considered overweight and 40% are considered obese. So you put that together, 72% of adult Americans are more susceptible to the coronavirus and the COVID-19, the diseases that it causes. So that's really concerning.
So, Doc, how does the excess weight increase the risk for severity?
It's a good question, Linda.
Yeah.
So when your body actually gets infected, for instance, with a virus or a parasite or bacteria, your immune system kicks in to protect you from these harmful germs. But when you are carrying extra weight, what can happen is that there can be metabolic changes that affect how well your immune system can fight off the disease. For instance, metabolic changes can lead to problems with insulin or increased inflammation in your body.
How do people know if they fall into this overweight or obese category if they aren't already aware, Doc?
Yeah, it's pretty simple, Dave. So to know if you fall in one of these categories, you need to know something called a BMI. So BMI simply stands for body mass index. And this number can be calculated using two things, right? Your weight and your height. You can easily find the BMI by searching online for a free BMI site. And once you get that, you know that the CDC has defined obesity as having a BMI of 30 or higher, and you're considered overweight if you have a BMI between 25 and 29. And if you find your number and you're in those categories, guess what? Be extra vigilant. Social distance, make sure that you keep yourself safe. And then it's really time to take advantage of nutrient-dense foods and get your rest and sleep. So that's how we fight this virus together. We know information and we figure out how to fight it and take precautions.
Yeah, caution and discipline, I guess, for all of us, right, Doc?
Absolutely.
Yeah. We keep learning as this goes along. So thank you, Dr. Nandy.
My pleasure. Have a good weekend.
You too. If you have a coronavirus question for the doctor, you can email him at drnandy@askdrnandy.com or send it to us on Facebook or Twitter.